Okay, so I wanted to record this patient that I saw in Foot Clinic recently. She has, as you can see, she's got a hammer toe on her second toe there, and she's got a callus that is pretty large, actually. You can zoom in and make it bigger to see it better and such. But the callus is pretty big. It's just right in that medial aspect bone on that digit there. And that's where a lot of times you'll see these calluses form. And it's just kind of a bony prominence, and that's why it happens that way. And so they get those and they rub against the other toe. They can be caused by rubbing against the shoe. And so what I do in Foot Clinic for these is just file them down. And you got to be careful with them and just kind of file gingerly because it is still, a delicate area, even though they have that callus. And so a lot of times what I will do is I will file it with either my hurricane bit that I'm using there, or I will file it with a different type of skin bit, but always use a skin bit on these. Just depends on how aggressive you think you're going to have to be to file that, which bit you're going to use between the different skin bit options that you probably have in your kit. The other thing I do is a lot of times they lift up, and you'll see here hers does. And so when that happens, you're going to want to kind of examine below that skin and see if that skin is intact, or is it becoming kind of fresh open skin, which is what you don't want. So there you can see I'm kind of looking and seeing what I got going on and making sure that it's still intact and such. You don't want to create any new wounds on these patients. And so you just kind of have to delicately go and sometimes do a tap motion to get that dead skin off of there. And you will see what we did is we just filed that down. And a lot of times patients can apply a urea cream to these, and that will help a lot. It kind of helps with exfoliating that skin in between visits. And so the next time she comes back to see me, that callus will come off actually a lot easier if she were to use urea. People using urea, it's just individualistic if they're going to do it or not. Some people can't reach their feet, so they don't apply any urea or anything to it. But that is always an option that I give patients, just to let them know that there is something that they can do in between visits with me. And urea acts as an exfoliant, so it helps to exfoliate in between the sessions and such. And so you're not going to get rid of it 100%, but you can get rid of it, I'd say, down to a good 70, 80% and make this an improvement so they actually feel better and it doesn't hurt them as much. And then I just go over their pressure points on their feet and such. So I hope that helps.